Please help me and give a warm welcome to Joe Almeida.
Thank you, Brian. Good afternoon. I'm going to spend some time, about 10 minutes, just giving you some perspective about innovation, but more so giving you a couple examples how innovation should be driven to give access, quality, and value to healthcare. At Baxter, we are a 85-year-old company that the mission is simply save and sustain lives, which seems quite simple, but it's very profound when we look at how many people we touch every single year. So we have about 60 million people in the world that one way or the other are touched by our products. Either therapies, IV solutions, peritoneal dialysis, anesthetic gases, hemostats, sealants, nutritional products, and antibiotics, all pre-mixed injectable drugs, mostly generic. When we look at innovation, the part that separates most companies that truly get it is the bridge between the invention and the innovation. The invention is highly valued in many places. However, the ability to bring innovation to the world, or that invention to the world, it what distinguishes most companies and creates a profound mark in the society that alter people's lives and health outcomes. So from many facets, Baxter has been involved in more than 80+ years in delivering products that have the ability to sustain lives. So you don't go to a hospital today without an IV solution. But to get to an IV solution, there's a significant amount of technology that goes behind that. Going into surgery, having the surgeon, the product to stop a significant bleeding into an arterial procedure, or a spinal surgery or a cranial surgery is very important to us. Over the years, we migrated the company into many different facets. Today, Baxter is about a $10.5 billion company in sales and operates in about 125 countries around the globe. But for us, the most important thing is the creation of that bridge between invention and innovation. The ability to create value in healthcare and access is quite significant. I worked for other companies, great companies in the healthcare space, and if you think about most innovations are focused in developed markets. Our treatments that cost $20,000, $30,000, $40,000. A significant amount of expenditures goes in healthcare and creates better lives. But the ability to take that innovation and bridge it across the globe, it's what differentiates people in healthcare. So understanding the dynamic of the geographies where we work is fundamentally important. And actually it's more complicated to create that invention-innovation bridge in emerging markets today than it is in developed markets, just by the pure economical aspect of the demographics and the ability to afford healthcare. So let me walk you through a very interesting part of our business. We are a company committed to treat end-stage renal disease patients. There's about 4 to 9 million people in the world today who suffer from this horrible illness. And why is the gap is so large? Because it's very difficult to diagnose patients. They are in very difficult parts of the world, like Indonesia, Vietnam, Africa. So our estimate is 4 to 9 million people today suffer from this disease, which about only 2.8 million are treated. So I'm going to take a little bit on a memory lane. We started about 45 years ago with an invention that originated itself as a sausage manufacturer and just a steel tub. And this was the closest 45 years ago of an artificial kidney. At Baxter, we took that idea and transformed it something a little bit more palatable to the hospital. Actually, Cleveland Clinic was the first adopter of this technology. And today we have migrated to a product we just launched actually yesterday called HDX therapy for in-center hemodialysis, which is the closest product in the market today to an artificial kidney. So this is made in Europe, in Germany specifically, through a significant amount of technology membranes that allows a great deal of toxins to be filtered in a very efficient manner. We call this technology HDX. This is one way of treating ESRDs, patients. There's a different way of doing it. So if you are treated in a clinic, you go to the clinic 3 times a week, 4 hours a day, and a significant amount of your day and productive time is spent being treated. But it also can be treated with peritoneal dialysis, which started many years ago, which uses the peritoneal cavity through an osmolytic solution to filter all the toxins. Well, there's a huge difference in treatment between peritoneal dialysis and hemodialysis. Today, there's about 336,000 patients that we treat with peritoneal dialysis, which is just about 12% of the total population. So why is that we cannot treat more patients? And a lot of the barriers have to do with innovation and access to data. So the patient goes home either with a gravity system or with a little pump called cycler, and the solutions are delivered to the patient every 15 days, large volume of solutions, 5 to 6 liter bags. But there's no communication between the nephrologist and the patient. And the information that is collected is reviewed probably once a month when a little SD card is removed from the machine and taken to the clinic. Consequently, not only the adoption is low, but also time on therapy is low. So if you think about the therapies are very equivalent, and the adoption is very low. So for many years, what have we been thinking about? Why can't we get the adoption higher? This is a big question that when I first got to Baxter, I asked. Well, now we have the ability to monitor patients at home in a very effective manner. We have a software called ShareSource that delivers the information to the nephrologist on a daily basis. And what we've been seeing right now, sifting through our data, is that there are long stay on therapy and much lower dropout rates from the therapy because of technology. So the innovation here is not very difficult to think through. And how do you create the next level of innovation? So why PD versus HD? Quite simply, you have lower hospitalization rates with peritoneal dialysis. We have about $15,000 a year in lower healthcare cost. So the key to unlock the adoption is truly innovation that brings access with quality and value as well. This is a great therapy that is now we have about 150,000 patients in this therapy. Now you think about what is looking ahead but this therapy doesn't work for emerging markets. It's an expensive therapy. You have requirements of logistical delivery to many countries. How do you deliver all these bags of fluid? We do in China, we do in Thailand, we do in Brazil. But what is the future? If you think about the 12% adoption rate, and you think about 4 to 9 million people, which only a fraction of is treated. What is ahead is understanding that we've got to make solutions on demand. So we'll be launching about 2 to 3 years for all emerging markets, 10 by 10 pieces of equipment that will be able to deliver about bags and treatment to 100 patients on a local area. So you think about a vending machine concept that will eventually be able to address the access to the technology for treatment, also at a much reduced cost, a fraction of the price, because the technology, the membrane technology we're going to use for filtration. So this is one way to address. To continue the evolution in developed countries, we'll be launching technology that makes the solution at home and customized to the patient, so there's more longevity of the peritoneal membrane in the body. Doesn't get brittle, because it gets brittle and the technology doesn't support more than 3.5 years of treatment. So 2 different solutions, 2 different environments, but addressing the same equation of access, quality, and value to our patients. So with that, I would like to bring Brian back to the stage for some Q&A.
Great. Thank you very much, Joe. Thanks for your fantastic comments and insightful comments. We're going to take some time here, maybe have a conversation, hear some questions. I'd encourage all of you to text your questions in. I'll go through your questions and ask your questions. Great opportunity for us to be able to ask them of Joe here. Joe, maybe in general terms, as people are here in the audience and involved in many different companies, you've certainly had an experience of going through many different healthcare companies in many different ways. You've been at Baxter now, leading Baxter for less than a year. How do you come into a company like that and assess where the company is on innovation, and then really propel and foster it, to the direction you want to go?
It's easy to do it by the numbers. You can go in and do the vitality index, you can calculate, but innovation is more of a DNA capability. It's a capability that is achieved by companies that are very nimble, companies that learn how to fail fast and fail forward. So my experience was that I had a great group of scientists at Baxter, and that culture was not there. So when the culture is not there, you will insist in continue to develop things that are not going well, and becomes a real problem. And you see this in a lot of different companies. And there is an interesting thing to be second-time CEO, because you learn all the stuff that didn't work before, and if you really have a little humbleness, you learn from those experiences and launch differently into the new venture. So that was the culture part. Fail fast, fail forward, and go around again. The second thing is more a financial analysis of your business, and make sure that you have capital allocation properly done to the businesses and technologies they have the ability to succeed well. And those revisions of capital allocation happen often enough, so you don't get caught up in the wrong lane trying to do something that has either poor access capability, poor value, or quality of care.
That's interesting. It's interesting you make the comment about second-time CEO. I remember my wife always tells me it's too bad our second child wasn't our first. I would have been a much better father. I learned so much from that first time. A lot of things going on in the political environment, the ACA, a lot of changes in healthcare. Tremendous focus on cost. You talk about access, about quality, and about value, and certainly value is about outcomes over cost. Mm-hmm. This pressure, which is a good pressure, I think, that we need to respond to and figure out how we make this better for our country. Is this pressure on cost accelerating innovation? Is it slowing down innovation? What's the effect this is having on innovation in the healthcare space?
I think in the beginning you get paralyzed, and you're going to go into a mode to fight and understand how to do away with some of the pressures in price, and you create SKUs and you do things that sometimes are not the most productive. And this, I would say, is the reaction of the past. I believe the reaction of the present and the future is accelerate innovation to be able to overcome the cost barrier. So I give you a couple of examples. We had a program that we had invested in hundreds of millions of dollars, was a home hemodialysis machine. We did not see that technology delivering on more access, neither value. And the quality was going to take a significant amount of work to get to the quality that we needed. And in the past, you would fight the current. You would get perhaps higher reimbursement, higher paying, and deposit even more money into a technology. We just said, this is not the way to go. Because we can do better. We use this money to self-service machines, to create a more robust data analytics that will fuel our PD home therapy. And we already have some technology that can be used in home. So the ability to understand the undercurrent, that you cannot go out and continue to hammer on pricing and do things like that, and have the ability to be compensated fairly, but also understand the dynamics so you don't get caught trying to fight the current and not using your time, which is valuable, and the capital of the company in putting against things that will create the value, access, and quality.
I think that's a really good point. You know, we talk in our organization a lot of times about we undervalue sometimes time. You know, and time is just as important as the financial aspects, and especially as we go forward. Some very good questions have come in. Let me ask you this question from the audience. You speak of the importance of culture. What do you do at Baxter to build a culture that drives for innovation and, quote, failing fast and forward, end quote, in the risk-adverse environment of healthcare?
Very difficult. Very difficult.
We thought you were going to give us the answer.
It's 24/7. There's no magic bullet. There's 24/7 work, tenacity, and you pick all your battles. So I'll give an example. It's a very risk-averse environment. You've got to get creative people to understand how to deliver the innovation in a faster way, right? So what I usually do, we tackle the processes that we think are the most complex. I talk to my employees probably very often, but once a quarter, and my presentations in town halls and state of the companies are all about examples. So you pick examples one at a time, and you go deep on those examples. I talk about product registration in China. It was taking us way too long. We focused on, we cut in half. Most of the problem was not the Chinese authorities, was inside Baxter. We talk about advertising and promotion and creation of brochures and literature and data investment. It was taking us a long time to do. It was hampering our ability to compete effectively. So you take that and you drill and then you broadcast. So it's one example at a time. You drill, you solve, and then you broadcast. And people who really want to be around will take those cues and start bringing to you all the other things that can be done and the possible. It is a relentless and very tenacious job you've got to do.
That's interesting. I think that culture, we all know that the secret of our success of all of our companies is culture. It's not something that can be changed easily. And I think what you're saying is the importance of continuing to work on the culture and understanding the value of it.
There's a say, culture will eat strategy for lunch. And if you don't believe it, trust me, we'll do it for breakfast, lunch, and dinner, no matter what you choose. Culture will take a company to its top performance. It can take a company down so fast. And it's all about leadership and the people that you have around the table leading the company.
The similar comment we've talked about is strategies can be replicated, cultures can't. Cultures is your value as a company. I think, Joe, you're talking about, what I hear from you is really working on strength-based leadership and really bringing out the strengths, modeling them, and then celebrating that success and driving that through the organization, which I think is really important from a strength-based approach, opposed to going after the deficit.
Well, you've got to, I don't know how many people here read the book Moneyball, but you have a team here in Cleveland which made it to the World Series, and one in Chicago. The Chicago folks When you look at baseball team, and it's tough for a Brazilian to talk about baseball, but it's tough to do in soccer because they're very undisciplined and they do whatever they want. So you've got to be really focused on who are the right folks for the moment, and how do you build strength on people's needs for improvement. So whatever, if you surround yourself with the talent of every single skill that you don't have, you've got to be the least smart person in the room if you want to lead well. If you're the least smart person in the room, you're well served, and I can guarantee you'll be successful with humbleness, humility, and servitude to the patients and to the customers.
It's actually interesting you bring up Moneyball. Many of you in the audience, especially from Northeast Ohio, may know actually Mark Shapiro, who was our general manager, who left and actually went to Toronto, was one of the early on people in Moneyball, and certainly does have a role in why we are where we are today.
Yep.
I know you are from Chicago, so before we go on, I do want to apologize about the Cubs going on to lose the series.
You don't need to. I've been in the U.S. for almost 30 years, and I've been in the Northeast most of my life, so I'm a Red Sox and Patriots fan. So I'm okay, I'm immune, but I'm going for the Cubs because I have 6,000 employees. We have 6,000 employees in Chicago, and the city is absolutely, beside themselves. They're so excited, so we'll see.
That's great. That was a pretty cheap way for me to get an applause, but I'll take it anytime, Joe. With respect to changing the culture, and in this case certainly at Baxter, are you able to accomplish this with the exact same people? How much fresh blood do you need? Where does that play into?
There's not a formula. So sometimes you see leaders who come into a company and replace everybody sitting around the table. You've got to be able to evaluate, and I have a very simple rule. You're coming in, you have different ideas, and the main thrust of the conversation is, can you make the cut? Do you have the ability to culturally yourself change the work environment and be a change agent? Some people will immediately say, it's not for me. Some people will hesitantly, okay, I will try, and some people just absolutely go for it. You've got to know those three different groups of people and very quickly address the first one. You want people around you who really want to make a difference. And when you're in a medical company, healthcare company in general, no matter what, it's all about the patient, it's all about your providers, people who are at the very end of your product. So it's not very difficult to wrap your head around the right things to do. The thing is, you've got to have the energy and the stamina to stay on that mark. So the first group you address right away, the second you look, you watch carefully, and the third one, you keep feeding them everything that you can so they'll absolutely flourish.
Here's a question that comes in for you, Joe. Regarding the pressure to make profit, which certainly is your responsibility and your fiduciary responsibility is to make a profit, can you talk a bit about your views on separating the innovation centers from the profit centers? Or maybe in another way, do they need to be separate, or are they actually related?
So you've got to have the ability to fund things 100% when you decide to fund them. And I think more important about talking about the profit centers and how you allocate those things is more about, did you fund the program for 1 year, or you fund the program for the lifetime of the program with specific milestones that you can decide yes or no, because the assumptions made today will change. As long as you understand how they will change and how to adapt is fine. One thing that really kills innovation is the stop and go. And the stop and go is done usually because the profit pressure. So you've got to know what you can afford to do and do it very well. Doing multiple things, not doing them very well, or funding them for a year or two and then slowing them down and accelerating, that approach is really toxic to the organization.
That's great. That's interesting. Joe, you talk a lot about the emerging markets, and I thought that was really inspiring to hear your vision and where you're taking Baxter in regards to that. What's the role for a company like Baxter or other healthcare companies with public-private partnerships, driving innovation, partnerships with academia? Where does that go?
It is is important. When we talk about end-stage renal disease, for instance, the therapies are paid by the government in most countries, even in the US. After 30 plus months into private insurance, Medicare will kick in and will cover anybody from any age on this disease. So it's important that you partner with them to understand how to bring the quality, the value, and the access. I think you can have several different styles of partnerships. I think NGOs bring us significant opportunity. I would say that it has to be a true partnership, where sometimes you find the issues is the protectionism comes into play, and you can get your really innovation in place and becomes really difficult to operate. So you've got to be very clear about who is your partner and what is at stake, and what are the valves to be able to let things alleviate when things are not going well, because most partnerships are very difficult to foster and to actually to make it all the way to the end. So I would say they're valuable. Make sure you have a good plan in place and have an agreement that is flexible enough that give both parties the ability to benefit not only profitability, but also there is a pool of patients, pool of data that you have access. So not very easy to do, but if you do it right, it can be significantly important to the company.
And certainly, Baxter, you have it going on a great trajectory, as you see, just in the short time you've been there already. But what's the role for a healthcare provider similar to Cleveland Clinic or other healthcare providers? What role does a healthcare provider play in stimulating innovation, working with companies like Baxter?
Huge, because this is about creating, if you have in mind access, quality, and value, and you're coming up with a significant amount of ideas. If we don't have the collaboration of the providers, the payers, the caregivers, we can get a perspective. And that is clearly a deficiency, that sometimes we go way overboard in how we look at the partnerships between the clinicians and the companies, and the clinics and the hospitals and the companies, because it can be significantly beneficial for the patient and for the system. Those relationships got really strained over time. You have sunshine acts everywhere, very difficult to relate. Some companies take a very radical approach of not allowing a significant amount of interaction, which I disagree. I think things need to be done in accordance to the law, but a significant partnership. The other day we're talking about a panel to help us into a hydration monitor that we're looking at. I said, you've got to get people from across the globe, a minimum of 10 to 12 people. And the company in the past had a little hesitation. Why would you do that? So you do that because those are the folks who will tell you the truth. They are telling you not what you want to hear, they tell you what is the truth. So if you don't have a good partnership and a role in people telling this is not critical. I give an example. Many years ago, with somebody from the Cleveland Clinic was in a panel, and he stood up and said, this technology is a waste of time, and you guys are going to have these problems. And long and behold, we understood much better after that comment. It was a much longer conversation. You have much about 3-4 hours. And we went back and looked at our assumptions, and we ended up changing and actually eventually canceling that program, which is the incorporation of some vision system into arterectomy, and was the right thing to do, and was through the participation and collaboration of a provider and a payer.
I appreciate that, because sometimes we're accused of being a little too opinionated at the Cleveland Clinic, so thank you for listening.
I always listen to you.
Maybe time for one more question. Big focus on healthcare, and certainly at the Cleveland Clinic, is moving towards population health. And making the steps, and we're down that road, we're mostly down there, continue to grow in that way. Population health, just like you talk about value, it's moving from volume to value. It's about taking care of the health of the population, and it's a focus on well care instead of sick care. So that's what's going on in the healthcare provider. How does a company like Baxter prepare? What are your steps in preparing for moving to this different world?
It starts with our own 50,000 employees and their families, and translate into how we filter what we're doing in terms of population health. So are you going for a niche or you're going for a large impact. Not everybody can have a large impact program, neither people want to boil the ocean. But you've got to have the healthcare economical portion of it and how you affect large swaths of the population. So when we speak about putting 20, 30, 40 machines, for instance, in Indonesia, and creating localized vending machines for people to take the bags for peritoneal dialysis home, that affects a large portion. Look at the size of Indonesia, but look at the geographical difficulties of the country. How many islands you have there, and how do you transport things? So you've got to make sure that you have the ability to adapt your solutions that affect larger groups of people. Population management and prevention of illness is one of the most important things we all can do. You start with our own companies and translates in how we filter products in the future that will affect large groups of people.
Fantastic. I can't thank you enough for coming to Cleveland and spending the time here with all of us and giving your insight.
Thank you for having me.
Thank you very much.
Thank you.
Thank you very much.
Thank you.
What a great session. What great insight from Joe Almeida, CEO of Baxter.